Ladies and gentlemen, welcome to the series of seminar videos on Germanische Heilkunde by Dr. Gerd Hummer, MD. My name is Helmut Pilhar. I am the father of Olivia, and the lecturer appointed by Dr. Hummer on Germanische Heilkunde theory. Using several sensible biological special programs, we will discuss the Hummer's compass, synchronously on the three levels: psyche, brain, organ. The conflict, the active phase, the solution, the healing, the crisis, and the end of the healing phase. The individual, the inseparable, is an indivisible unity between the psyche and the organ level. There is no organ disease without a correlation in the psyche, and vice versa. A medicine that does not consider this inseparability is piecemeal, unscientific, and belongs to the past. We, in Germanische Heilkunde, have a third level, the brain level, with a Hummer focus in the brain CT. The biological conflict shock, the DHS, the cause, immediately leaves the Hummer focus in the brain. It can be photographed immediately. Until the organ symptom, on the other hand, is noticed, a certain time can pass. If we know one of the three levels, we know the other two levels. Several case studies illustrate this. To us medical laymen, the brain level is closed. Who can read a brain CT? But nobody knows our organ level and our psyche better than we do, and they always proceed synchronously. The objective is to learn to understand the organ level. No pimple without corresponding defilement conflict. And the pimple is already the healing phase. You will learn more about this in the approximately 2-hour seminar video. Ladies and gentlemen, I welcome you to the seminar tutorial Germanische Heilkunde by Dr. Gerd Hummer, MD. The topic today: synchronicity. Psyche, brain, organ. With the first biological law of nature, the iron rule of cancer, we have the third criterion, which says that the course of conflict is synchronous on all three levels: psyche, brain, organ. We only think of these on three levels, in order to be able to work with them more easily. In reality, however, the individual is an inseparable unit. The term, individual, comes from Latin, and means indivisible. Thus, it is possible at any time, to conclude from one level to the other two levels. The Germanische Heilkunde, the therapist will always consult all three levels, in order to be able to determine the DHS clearly and, if necessary, also the conflict resolution. The DHS is the pivotal point in Germanische Heilkunde, because the therapy must be derived from the DHS. If there is already a healing phase in the affected person, the conflict resolution that took place must also be found. How was the patient able to resolve this conflict, and at what point in time? This allows us to estimate the conflict load, and thus the healing phase. We can also thereby recognize whether there are tracks or not. For the patient himself, this understanding of the synchronicity of his three levels is fundamental. On the one hand, this helps him understand the reason why he has his symptoms, and on the other hand, he sees himself in a position to act wisely. So he understands how long his healing phase will last, and does not despair. Or he understands that he has to change something in his life, to get better. The affected person is not helplessly at the mercy of the therapy, as in conventional medicine, but actively contributes to his therapy. He is the therapy, and will only need an emergency physician as a mechanic in an emergency. If an oncologist wanted to explain that he needed chemo, the patient would laugh at him. Out of 100 cancer patients, 80% will recover spontaneously without conventional medicine, provided they are not frightened and panicked. A study from France, by Marc Frechet, shows that 85% of cancer patients were alive after 9 years. These patients had these connections explained to them, and no one frightened them. At the moment, however, we do not have such a helping hand ready, unfortunately. The deep state prevents it until today. Therefore, we ourselves must learn to understand it, and that is why my motto is, inform yourself while you are healthy. So that you, dear student, can better understand how to deal with these three levels. I would now like to fly through this Hummer compass with you. Using various special programs, we will now discuss point by point, and phase by phase the Hummer's compass. As well as all this simultaneously and synchronously on these three levels: psyche, brain, organ. We have three salient points: the conflict resolution, and the crisis. We have four phases, The health, the conflict active phase, the healing phase, and again the health. We have all of this synchronously at the 3 levels. So, from a purely mathematical point of view, we have 4 plus 3 times 3 equals 21 criteria. For each individual criterion, the 5 biological laws of nature must apply at all times. So we have 5 times 21 and thus over 100 facts that can be queried. And this only with a single special program. If the person concerned has several special programs running at the same time, everything is multiplied. That all this should be true purely by chance is so absurd. Especially since it can be reproduced from millions of people in every next patient case. In other words, the probability that the Germanische Heilkunde is correct in the scientific sense is 1. It is certainly not possible for us medical laymen to verify these facts exactly. Who can read a brain CT? I can't. And you probably can't either. But nobody knows your organ level and your psyche better than you do. And it always runs synchronously. If you have a symptom and can interpret the organ level, you know which conflict you have to look for in yourself. And this conflict is still timely at the first appearance of the symptom, and one can remember it relatively well. And with the conflict, we know the cause. According to the motto, danger recognized, danger averted. You also know what to do now. You can keep the conflict load and thus healing phases low. One can help oneself highly efficiently. One rises, figuratively speaking, for the first time from his involuntarily controlled animal body, and learns to live willfully. In such a way that one becomes healthy and remains so. The Germanische Heilkunde can show a way out of this civilization scrap society. Actually, we would only have to pay attention to our biological code. Let's start with absolute health. What does it mean to be absolutely healthy? In absolute health, we have the normal day-night rhythm present. During the day, we are sympathicotonic, and our ergotropic organs are innervated. Such as the brain, heart, skeletal muscles, etc. During the day, we are in everyday stress. We have to work or go hunting. Our hands are cool during the day. At night we are vagatonic, and our trophotropic organs are innervated. Like the digestive system. We sleep. Our body rests and draws new energy. Our hands are warm. You know this phenomenon. When you go to bed later than your partner and snuggle up to him, he feels boiling hot. However, your partner is not sick and does not have a fever. Because of his vagatonia, his vessels are dilated. On the level of the psyche, one would be in absolute health, and utterly free of obsessive thinking. Every conflict gives us obsessive thinking immediately. Our brain immediately looks for a solution to the problem. One dreams one's unresolved conflicts at night. Therefore, in absolute health, one has no recurring dreams. And there is no difficulty falling asleep, or staying asleep. There is no hum or focus at the cerebral level. Neither a shooting disc active, nor edematized in the healing phase. The brain would be a virgin. Old, scarred humor foci, where the healing phase has long since been completed, may well exist. Scars remain, as on the organ level so also in the brain. However, such scars usually do not disturb at all. At the organ level, there is no excessive cell proliferation. No excessive cell loss, and no functional failure at any organ. If one looks over all sensible biological special programs, SPS, one can distinguish these 3 different groups. So this individual would not have a single special program running, and would be absolutely healthy. Honestly, I don't know a single person who doesn't have at least one special program going on. I only need to take myself here. My hair is getting less and less every year, which suggests an active separation conflict. My eyesight is getting worse, suggesting fear in the neck conflict. My teeth are not in good condition, which suggests biting conflict. My low back sometimes makes itself felt, which suggests a self-esteem slump. My diaphragm occasionally causes me shortness of breath, which suggests an overwhelming conflict, etc. I certainly have about 10 different special programs running, every now and then. And with you, it will probably not look much different. Go through all your little complaints once in a while, and you will come up with a similar number. In middle age, these are the various scars of the previous life. The more unbiological the form of society, the sicker the people. However, one is considered healthy despite the ongoing special programs, only because one has not yet been examined from head to toe by a conventional physician. If one would do that, he would indeed find something. Note: in conventional medicine, anything with an excessively high cell division rate is considered evil. When does conventional medicine actually diagnose cancer? What is cancer? Pulmonary nodule. Let's assume you are a bank employee, and the supposed customer holds a gun to your chest. You shockingly associate your imminent death. The customer is stored in your memory as a track. From now on, every customer is a potential bank robber for you. At least, that is how your subconscious has stored it. As of now, you are allergic to customers. With a conflict relapse, that keeps restarting the special program lung alveoli. On the brain level, you have the Hummer focus in the two brain relays right and left in the brainstem for the pulmonary alveoli of both lungs. This Hummer focus arises instantaneously with the DHS, and is disc-shaped, sharp-ringed. For the conflict active phase, it remains unchanged and does not cause any space-occupying lesion. Thus, brain symptoms are not present. At the organ level, starting with the DHS, you have cell proliferation of the pulmonary alveoli. And many pulmonary round foci develop bilaterally. How does the conventional physician determine whether the tumor is benign or malignant? When a cell divides, it has doubled its cell nucleus shortly before its division, and is therefore larger than a cell that is not currently dividing, and has only one cell nucleus. Therefore, the conventional physician takes a tissue sample and, under the microscope, counts off the large cells. If he finds more large cells than he would find in healthy tissue with a regular cell division rate, he makes a diagnosis of evil. These lung alveolar cells continue to divide, until this death scare is resolved. So, the lung round foci get bigger and bigger. In this permanent sympathicatonia, one also has little appetite and loses weight. Often the patient is examined only after a noticeable loss of weight, and is then diagnosed with lung cancer. A patient, diagnosed with lung cancer, therefore has an active fear of death conflict. If he has many lung round foci, then he has this fear of death for himself. If he has a single pulmonary round, then he has suffered this fear of death for someone else. These patients have ice-cold hands. If the patient releases this fear of death, then the cell division stops, and there are no more large cells. His hands would become warm again. From the conflict resolution, conventional medicine then no longer speaks of malignant lung cancer, but of pulmonary tuberculosis. In the lung chapter, we discuss this SBS in more detail. Suppose you go to the garden and see your son lying motionless under the cherry tree, under a broken branch. In this case, you associate a care conflict about your child. You memorize the tree, together with your climbing son as a track. From now on, you react allergically with conflict relapse, as soon as your son climbs a tree again. At the brain level, you have the Hummer focus shooting disc-shaped in the cerebellum. Crossed out to your mother-child side either on the right or left outside, depending on handedness. You have a cell proliferation of the mammary glands from the DHS, and develop a so-called mama CA on the organ level. In a few weeks, you will palpate this lump. Because of the large cells, you now also receive a diagnosis of malignancy, from the conventional physician. So, the patient with a diagnosis of breast cancer has an active care conflict, dispute, nest conflict, and ice-cold hands. Let's say your son complains. Dad, you are the worst dad in the world. In this case, you associate a self-devaluation conflict towards your child. From now on, you react allergically with a conflict relapse towards your bad conscience towards your son. At the brain level, you have the Hummer focus crossed out in the cerebral medulla to your mother-child side. Either right or left in the relay for your shoulder, depending on handedness. A severe self-devaluation conflict would affect the bone, the less severe one would go to the cartilage, and the lighter one to the lymph node. These organs belong to the connective tissue. However, the connective tissue now does not make cell proliferation, but the opposite, namely cell loss. Necrosis, holes. This active phase is not noticeable. If you were to cut the lymph node, it would look like Swiss cheese with its holes. You have no pain and do not go to the doctor. You have ice-cold hands. Now you run into the toy store and buy your son a train set. He falls around your neck and says, "Dad, you're the best dad in the world." The stone falls from your soul. Now the necrosis stops, and with the help of the associated microbes, the bacteria, this connective tissue is rebuilt through cell division and swelling. This causes significant shoulder pain. You have warm hands, as any vagatonic healing phase. The lymph node is now swollen, palpable and painful. You run to the conventional doctor. He now finds large cells, and diagnoses you with malignant lymph node cancer, or Hodgkin's disease. Your hands are boiling hot. Introductal mama memory ducts. Let's say, your 18-year-old son opens up to you, "Mother, I've signed up for Afghanistan." Bang! You suffer a separation conflict from your son at the milk ducts of your mother-child breast. During the conflict active phase, this squamous epithelium ulcerates. The biological purpose of this special program is in the active phase, by ulcerative dilatation of the milk ducts, to facilitate the outflow of breast milk. The squamous epithelium of the mammary ducts belongs to the so-called external skin pattern. It is, therefore, sensory paralyzed and numb in the conflict active phase, and only hurts in the healing phase. As long as your son is in Afghanistan, your conflict will remain active. The milk duct may shrink serous. A dent is formed on the outer shape of the breast, or the so-called slippery nipple is formed. You may also be diagnosed with microcalcification, which is caused by the breast milk that has been left behind in the milk duct that has shrunk serous. The breast may become smaller overall. It is cold, but does not hurt. But when your son returns from Afghanistan, 6 months later, and says, "Mother, now I'm going to be a baker across the street," and then the stone falls from your soul, and you enter the healing phase. The ulcers of the active phase in your milk ducts are now refilled with swelling and inflammation by the microbes. The breast is swollen, hot and painful. If the conflict load is not as great, the healing phase of the milk ducts is now called mastitis. If the conflict load is greater, it is called a malignant intraductal mammary CA. As a patient, you have noticeably warm hands. The diagnosis malignant because of cell division. Dr. Hummer said that the conventional physicians have therefore not come across the two-phase nature, because they have apparently never shaken hands with the patient. This would have allowed them to recognize that there are two groups of malignant diseases. One group of patients have ice-cold hands, are sympathicotonic and conflictive, hardly eat, and have difficulty falling asleep and staying asleep. The second group of patients, on the other hand, have boiling hot hands, are vagatonic and conflict resolved, eat well and sleep until lunchtime. It can't be the same. It is not. In the old brain-controlled special programs, that is, the SBSs controlled from the brainstem and cerebellum, we have cell proliferation in the conflict active phase. In the cerebrum-controlled special programs, that is, the SBS controlled from the cerebral medulla and the cerebral cortex, we have cell proliferation in the healing phase. The problem is, this nonsensical division of conventional medicine into good and evil. In nature, this principle does not exist at all. Neither is it evil for the cat to eat the mouse. Nor is it evil of the mouse if it does not let itself be eaten by the cat. Mother Nature does only sensible things. Fetus in the womb. How nonsensical this arbitrary classification is, can be seen in the fetus in the womb. Through cell division, the fetus becomes larger and larger, and should actually be classified as malignant. The pregnancy can also be quite dangerous and fatal. It behaves in such a way similar to cancer. However, no one would think of routinely cutting out all fetuses from pregnant women. Why not? Where is the logic? There is no logic in conventional medicine in this respect either, but dogmas instead. Often these dogmas are religiously motivated and basically paranoid. Tumor marker. There are tumor markers that indicate excessive cell division. If this tumor marker is positive in the woman, then she either has cancer or she is pregnant. This tumor marker, therefore, also indicates cell division in the fetus. In the male, the possibility of pregnancy is ruled out. The man must therefore have cancer somewhere, according to the definition of conventional medicine. This sinister school of medicine can declare itself the ruler over life by this arbitrary classification. It determines what is to be considered evil, similarly as the Church in the Middle Ages. Note, in conventional medicine, that which causes excessive cell division is considered evil. Since there is no malignancy in nature, there can be no malignancy in our body either. We humans are children of Mother Nature. We can now see with Germanische Heilkunde that all special programs have a biological sense. And this biological sense is always purposeful, to solve the cause of the necessary special program. We actually have the therapy programmed into our body. Should a conventional doctor diagnose you with lymph node cancer, then you reply, "Thank you for the good news, doctor. Thank God I was able to resolve my self-esteem issue." For our further journey through the Hummer's compass, let's now let it come back to an arbitrary event. Let's say your phone rings, and you get the message that your child has been in a traffic accident. What happens to you? There are now two possibilities. You suffer a conflict. You do not suffer a conflict. You do not have to suffer a conflict at all. If you yourself have secretly tampered with the brake line on your child's car, and you finally receive notification of the accident, you may even be happy about it. It was neither highly dramatic for you, nor did you get caught on the wrong foot. You were expecting this accident. It may also be that you have no children at all, and the caller was a prankster. In these cases, you also suffer no conflict and remain healthy. The DHS on the psyche. But let's assume that in the seconds of this message on the phone, all three aspects of the DHS are fulfilled. It is highly acute dramatic for you, isolatedly felt, and caught on the wrong foot. You are suffering a biological conflict. What happens to you now? Your vegetative nervous system immediately switches from eutony, that is, from the healthy day-night rhythm to sympathicatonia. And remains there until the stone falls from your soul, and you can solve the conflict. In the moment of shock, you immediately get ice-cold hands. If you are eating, you drop your knife and fork. Your appetite is blown away. If you are dozing on the sofa, you are instantly wide awake. You immediately have obsessive thinking. All your thoughts now revolve around your injured child. For the further study of Germanische Heilkunde, you now lack the nerves. Every fiber of your body is sympathicatonically focused on conflict resolution. This immediate mobilization of all forces energetically helps in conflict resolution. It would be non-biological and counterproductive to dampen your stress with, for example, vagatonic Valium. Because then you would hardly be able to achieve conflict resolution. You hold the phone and you are in shock. What do you now mentally assign to this event, which is a conflict for you? This thought assignment occurs involuntarily and completely past your mind. Before you can even think about it, the Dirk-Hummer syndrome, DHS, has already happened. My child is dead. At this moment of shock, if you associate that your child is dead, you have the Hummer focus in the brainstem, and you respond cell division of the pulmonary alveoli. In fear of death for someone else, you develop a single pulmonary round. My child is badly hurt. If you associate in this moment of shock, that your child is lying badly injured and bleeding on the street, then you have the Hummer focus in the cerebellum, and you react with a cell division of the mammary gland cells in your mother-child breast. In this case, you are now developing a mama CA. I am a bad parent. But it is also possible that you associate on the phone, what a lousy parent you are. With a Hummer focus in the cerebral medulla, and with necroses in the connective tissue concerning your mother-child shoulder. Because you did not take enough care of your child, this misfortune could happen. So you have a self-devaluation conflict, bad conscience, towards your child. The severe self-devaluation conflict, SDC, affects the bone. The less severe SDC affects the cartilage, and the mild SDC affects the lymph node. My life's work is lost. On the other hand, if you are a farmer and learn of your son's misfortune, this may be a loss of territory for you. The son was supposed to take over your farm. Now the son is gone, and so is your territory. You have the Hummer focus in the territorial area of the cerebral cortex, depending on left or right-handedness. The squamous epithelium of the coronary arteries is controlled from these brain relays, which is now ulcerating. This squamous epithelium belongs to the so-called pharyngeal mucosal pattern and immediately hurts in the active phase. As of now, you have angina, heart palpitations. This must not have happened. However, it is also possible that you resist this communication in the moment of shock. No, this must not have happened. Depending on your handedness and hormonal situation, you have the Hummer focus in the brain relay for the sugar relays of the pancreas, and react with hyperglycemia or hypoglycemia. So from now on, you have diabetes or hypoglycemia. And you are constantly eating and gaining weight. Notice 1. In the same event, the information on the phone about your unfortunate child can lead to conflict. But it does not have to. It can lead to this or that special program, depending on what you associate at the moment of the DHS. The DHS in the brain. You are still standing with the telephone receiver in your hand, and are in shock. Your brain has associated by the involuntary thought assignment. This conflict content, in turn, determines the localization of the Hummer focus in the brain, which in turn determines the organ reference. This Hummer focus arises at this moment of shock, and is worth discussing in some detail. The Hummer focus is the proof. In Dr. Hummer's book on basics, there is a revealing CT series of a patient. During a CT image, this patient lying in the apparatus suffered an epileptic seizure. In the image before the seizure, no Hummer focus is seen. In the same image 4 minutes later, the edema is clearly visible. The crisis is, after all, part of the healing phase, during which there is obligatorily always edema in the respective brain relay. Within these 4 minutes, the patient must have come on a track of a motor conflict, presumably by lying rigidly in the machine. She relapsed, immediately detached, and had her epileptic seizure. Dr. Hummer told me about another patient case from Vienna. After a CT scan, the doctors told the patient they suspected he had a brain tumor, and urged him to have more scans. The patient suffered a fear of death conflict with this bad news. And the Hummer focus in the brainstem was then visible on the follow-up scan. Note, this Hummer focus arises directly with the DHS. Until the pulmonary focus, the lump in the breast, etc., is noticed on the organ level, a certain amount of time passes. In the brain, however, we can diagnose the event immediately after the cause, the conflict. The famous cellular pathologist Rudolf Virchow is reported to have said, "I have dissected so many corpses, and never found a soul." He believed the cause of the disease was to be found in the cell. For 100 years now, conventional medicine has been looking deeper and deeper into the cell, knowing more and more about less and less. Until at some point, they know nothing about everything. For trees, conventional medicine does not recognize the forest anymore. Their doctrines have remained unchanged for 100 years and are in an epistemological dead end. The cause of the disease is not in the cell, but in the DHS. The now starting special program produces altered cells on purpose. As long as conventional medicine does not recognize the patient as an individual, that is, as an inseparable unity between psyche and body, it will be denied to be true healing art. Basically, however, mankind has always known that illness somehow has to be related to the psyche. Too often, the obvious happened. A bad event hits a person, and he falls ill. Mankind has had to experience this again and again, but has never been able to discover a reproducible system. From this point of view, this Hummer focus is the missing link between the two levels of psyche and organ. It is the proof that the cause of illness has nothing to do with nutrition. Nothing with the sleeping place, nothing with heredity, and also nothing with an infection. Diseases also have nothing to do with guilt or karma. The cause of the diseases that arise by themselves, cancer, chronic diseases, allergies, and psychoses, is monocausal. They are caused only by the biological conflict shock, the DHS. If this is true, then the consequences are serious. Then the conventional medical therapy is pure nonsense. The mother has an accident with her child, worried about the child. She reacts with lumps in her breast. The conventional doctor diagnoses her with malignant breast cancer, and treats her with breast amputation, chemo, and radiation. The mother stumbles from one conflict to the next. However, it is not the lump in the breast that is the problem, but the injured and sick child. But no one from the oncologist cares about that. And exactly here lies the future paradigm shift in therapy. Is the purpose of therapy to eliminate the symptom? Or is the purpose of therapy to eliminate the cause? Of course, the therapy must be cause-oriented. The therapy for the mother means, the child must become healthy. If the cause is not solved, the symptom comes again. If the cause is solved, on the other hand, the symptom disappears spontaneously, by itself. And without any side effect. The amazing thing in the story about the order of Dr. Hummer's findings is also the fact that he submitted this Hummer focus only in 1983 to the University of Tübingen with the words, "So, now you can even photograph my claims." As is known, Dr. Hummer submitted his habilitation thesis 2 years earlier, in 1981. At that time, he explained that the patient's sensation in the moment of shock determines his now developing cancer. This is what Dr. Hummer did before he discovered the Hummer focus. His acumen was incredible. But also unbelievable is the fact that with the first developed computer tomograph in 1983 in Germany, and with the first look into the patient's brain, the cause of the disease was immediately discovered and immediately suppressed by the deep state. In the mainstream media until today, one gets served again and again inflammatory articles against Dr. Hummer. But this Hummer focus is never mentioned by the mainstream. That is exposing. The Hummer focus is also the striking proof. With the help of the Hummer focus in the brain CT, it can also be determined whether the conflict is active or has already been solved. In the conflict activity, the Hummer focus is disc-shaped and perceptive. In the healing phase, this shooting target configuration blurs into edema formation. Tracks, allergies, develop in the DHS. Look mentally into the face of someone who is in shock. The affected person opens wide his eyes, mouth, and ears. At the second in which this DHS arises in the brain, Mother Nature has given us a mechanism that stores all the sensory impressions accompanying the conflict. Our brain makes a snap like a camera at the moment of the DHS. If you bite into an apple at this moment, you first have to get your teeth into the apple. A taste sensation of sweet-sour comes at you. The brain deals with this apple. If a conflict arises, the brain stores this apple as a track. The brain now links the apple with this conflict. From now on, one has an allergic reaction to apple, with a relapse of this conflict. If you just drank milk, then from now on you have a milk allergy. But you can also react allergically to a situation or a person. If one reacted at that time with an anger conflict concerning the intestine, then one reacts from now on allergically with the intestine, when one comes on the track. If one reacted at that time with a separation conflict concerning the outer skin, then one reacts from now on allergically with the outer skin. If one triggers the track, whether this track is the apple, the milk, the telephone ringing, the weather, a certain person or situation, the mechanism is always the same. Note, every track presupposes a DHS. So every allergy points back to an unresolved conflict. However, from the conflict on, it is enough to bite into the apple or hear the phone ringing, that is to get on the track, to trigger a complete conflict relapse. Everything that is chronic, no matter what you call this disease, runs on tracks. There is a separate chapter on tracks, where everything is discussed in more detail. The DHS at the organ. The organ level is affected immediately from the DHS, according to the third biological law of nature, which addresses the developmental system of tumors, either cell proliferation, cell atrophy, or functional failure. Cell proliferation constitutes the SBSs that is controlled from the old brain, for example, lung cancer and breast cancer. Cell atrophy constitutes the SBSs that are controlled from the cerebellum, such as connective tissue and milk ducts. The functional failures are all controlled by the cerebral cortex. Here, there is neither cell proliferation nor cell loss, but rather a loss of function, as in diabetes. Note: the Hummer focus can also be photographed immediately on the corresponding organ. What will you do now? Instinctively, you will immediately try to solve the conflict. For such trivialities as eating, sleeping, studying, etc., you have no time to waste. Your child has had an accident. You will rush to your car and race to the scene of the accident. Conflict active phase. 5 minutes later, on the way to the scene of the accident we stop you, and shake your hand. Your hands are ice cold. You are not hungry, you have not even begun to think about whether you should get a snack at the fast food restaurant. On the level of the psyche, you have obsessive thinking. You have to be careful not to thunder through the intersection on red. On the brain level, you have the Hummer focus shooting target. At the organ level, your circulation is stable. You have cell proliferation, cell atrophy, or loss of function. How big do you estimate the pulmonary nodule or the nodule in the chest will be after 5 minutes of conflict load? 5 centimeters in diameter, or maybe even 10 centimeters. No, never. It may have just come to a first cell division. This tumor, or also this necrosis in the connective tissue or this ulcer in the squamous epithelium cannot be diagnosed by conventional medicine with any procedure, because of the vanishingly small size of what is happening. Even with diabetes, you burn up the elevated sugar on the way to the site of the accident. Also, the loss of function is not immediately detectable. In the brain, however, the activity of the SBSs could be determined immediately, based on the Hummer focus. Angina pectoris, heart pains, at the loss of territory, would be a conflict active symptom on the organ level and could be noticed immediately. In the other SBSs, the active phase is not always immediately noticeable symptomatically. You are also under stress and have mobilized all your forces to solve the problem. If you were told on the way to the scene of the accident that you have cancer, you would contemptuously brush aside this information. Scold the messenger and continue on your way to your injured child. You now arrive at the scene of the accident and the ambulance is transporting your child away. You cannot solve your conflict yet. You continue to build a conflict load. The conflict load is the blue area below the curve in the graphic, and is made up of the conflict duration and intensity. The longer the conflict lasts, and the more intense this conflict is felt, the greater the conflict load. And thus the greater the cancer. Thus, the larger the tumor, space-occupying lesion, or hole, necrosis, ulcer at the organ level. And, in the case of conflict resolution, the longer and the more intense the subsequent healing phase will be, and the more severe the crises will be. The two areas, the blue conflict active phase and the red healing phase, roughly correspond to each other. If you are conflict active for a day, you are vagatonic, tired, and flabby for a day. The body needs to recover. If you are conflict active for a week, you won't be able to get by with 1 day's rest. And you will be vagatonic and sick for a week, until you are finally fit again. And suppose you have 3 months of conflict load, then you're vagatonic and sick for 3 months. Now you're with the program for half a year. In that case, according to conventional medicine, you almost certainly have a cancer diagnosis, no matter what special program was running. 4 weeks later. How are you doing after 4 weeks of conflict activity? Your child has been in the hospital since the accident, and the doctors still don't know to say whether he will survive or not. On the level of the psyche, you still have obsessive thinking. Almost every minute, you think about your child in the hospital. You have trouble falling asleep and staying asleep. At night you wake up, get out of bed, go to the window, and wonder what will happen to your child. You can't fall asleep again. You have also lost your appetite since the accident, and have already lost a few kilos of body weight. On the brain level, in all SBS, the Hummer focus is sharp-brained and disc-shaped. In the conflict active phase, this Hummer focus has no space-occupying lesion and does not cause any symptoms in this regard. They also do not have a headache. At the organ level, the pulmonary nodule is already 1 or 2 centimeters in diameter. The same applies to the lump in the breast, which has already become palpable. The necroses in the bone cartilage, or lymph nodes would be visible to the naked eye, and so would the ulcers in the squamous epithelium of the milk ducts. If you could look into them. Diabetes is also noticeable. At night you get a dry mouth, and you need to drink something. In all cases, however, it would be more of an incidental finding. You would not have pain with any of these SBS, except for the angina pectoris upon loss of territory, involving the coronary arteries. 3 months later. How do things look for you, after 3 months of conflict activity? Your child is still in a deep artificial sleep in the hospital. The doctors just helplessly raise their shoulders, and don't know what to do. For 3 months, you have hardly slept and hardly eaten. It is evident that something is wrong with you. You have lost 15 to 25 kilos in this time. On the one hand, you are happy about this, because your attempts to lose weight have failed miserably up to now. Now, all of a sudden, losing weight is frighteningly easy. In the brain, the Hummer focus is still disc-shaped. At the organ level, the lung nodule is 5 centimeters in diameter. Likewise, the node in the chest is already clearly visible from the outside. The lymph node with its necrosis is not noticeable. The shoulder bone could fracture due to decalcification. Meanwhile, the ulcers of the milk ducts resulted in a noticeable dent in the breast. Or if near the nipple, a slippery nipple. You still have the angina pectoris. Your doctor has also most likely already diagnosed you with diabetes. Death from emaciation. If your child dies now, you will solve nothing at all. And you will continue to build up conflict load. The tumor or necrosis gets bigger and bigger. You do not eat, you do not sleep. At some point, your battery will be empty, and you will die of emaciation, unless you have already been treated to death in conventional medicine. So, the fact that a cancer diagnosis can occur at all is related to the load of conflict. There is a big difference in the size of the tumor. Whether the cells divide for only 5 minutes or whether they divide for 5 months. In the first case, it passes unnoticed. And it cannot be missed in the second case. The probability of a diagnosis within 5 minutes of conflict activity is also many times lower than catching a diagnosis within half a year. How often have you had a shock in your life, but it quickly dissipated? You had an SBS going on for that short time, but it was never diagnosed by conventional medicine. In our lives so far, we have very often spontaneously recovered. Each of us has, because otherwise we would not be sitting here today. Conflict resolution. Let us now resolve the conflict. 5 minutes later, you arrive at the scene of the accident and your child is standing safely on the side of the road. Nothing bad had happened. The stone falls from your soul. Now your vegetative, autonomic, nervous system, which you cannot control at will, inevitably switches from permanent sympathicatonia to permanent vagatonia. This conflict resolution takes place inevitably, and just as past the level of the conscious mind as the conflict itself. Attention. Conflict resolution is not always desirable, keyword, heart attack in case of a territorial conflict with more than 9 months of conflict load. On the psyche level, the obsessive thinking is blown away, and you feel great relief. On the cerebral level, the Hummer focus has so far been disc-shaped and sharp-brained without causing a space-occupying lesion. You had no brain symptoms during the conflict active phase. However, with conflict resolution, the nerve tissue in this brain relay now begins to store edema. You can think of it like a sponge soaking up a drop of water. This is now a space-demanding process that can cause corresponding brain symptoms, such as headache, nausea, double vision, etc. With conflict resolution, cancer stops on the organ level, and the loss of function stops. If you had cell proliferation, old brain SBSs, until now, this cell division stops now. If you have had cell atrophy, new brain SBSs, so far, this cell atrophy stops. If you have had a functional failure, cerebral cortical SBSs, so far, from now on, the function returns. Note, with the biological conflict, the cancer, SBS, begins. Cancer stops with conflict resolution. This explains the first 2 biological laws of nature. Where does cancer come from, and what is the solution? However, the healing phase still lies ahead. The healing phase. PCL phase A. A few moments later, your previously cold hands are now suddenly warm again. The tension falls away from you. You sit down to recover from this shock. Now you slowly regain your appetite. Food tastes good again. On the level of the psyche, all is well with the world again. Nothing has happened to the child. The problems of falling asleep and sleeping through the night disappear. At the cerebral level, the involved cerebral relay begins to store edema. The sharp rings of Hummer foci dissolve into an edema fringe. As a result, the intracranial pressure increases. On the organ level, the vessels change from narrow to wide. The extremities, which were cold until now, become warm. One gets a fever. Each healing phase also takes place at the organ level with the formation of edema, which also causes healing swelling and the associated pain. We are in PCL phase A, which is also called the exudative phase. The microbes. With the resolution of the conflict, the brain has switched on the microbes. The microbes now become active according to their task, and have a metabolism. Note: we always live together with microbes, because in nature, there is no sterile space. Our body makes use of microbes and needs them. If you take a swab from the tabletop, you will find microbes. Likewise in a swab from the cheek in the face, or from the oral mucosa. It is said that microbes are ubiquitous. That is, air always present everywhere. By the way, the only really highly infectious thing on this planet Earth is life itself. Turn over a stone, and you will find life underneath. If you dive into the depths of the seas, you will find life. Climb up the highest mountain, you will find some lichen. In the desert, you can find life. There is life everywhere. And that's nice, isn't it? But the microbes in our body become active only in the healing phase. In conventional medicine, these microbes are then called pathogenic, disease-causing, out of ignorance of the biological connections. In the active phase and also outside these SBSs, conventional medicine calls the same microbes apathogenic, not pathogenic. Why the same microbe can go suddenly from apathogenic to pathogenic, and then back apathogenic cannot, of course, be answered by the conventional medicine. Dogmas also need no explanation or justification. The fact that our brain controls microbes is unknown to conventional medicine. The old brain-controlled SBSs, pulmonary nodule, Mama CA, had their biological sense in the active phase. The biological purpose of the pulmonary nodule was to be able to take in more air through an increase in the number of cells in the alveoli. In order to be able to resolve this fear of death better, we must understand the SBSs from the history of development. Without air, we would die immediately. The biological sense with the Mama CA was likewise that by an increase of the milk glands, the mother would be able to provide more breast milk to the injured child, so that it would recover quickly. Now, with conflict resolution, the cause is eliminated, and it stops the cell division. The tumor, with its functional amplification, has become superfluous. Now these old brain-controlled tumors are decomposed by the microbes responsible for this, fungi and fungal bacteria, tuberculously, decaying, necrotizing. This can be thought of as an apple rotting. Typically, one also has night sweats during such tuberculous healing phases. The cerebellar SBSs, connective tissue, squamous epithelium, produced cellular atrophy in the active phase. Due to the necrosis in the connective tissue, the tendon may tear, or the bone may break. In the connective tissue group, luxury group, the biological sense is only at the end of the healing phase. More about this later. The microbes responsible for this are the bacteria that help to fill the holes of the active phase, under swelling again. The squamous epithelium of the coronary vessels ulcerated, increasing their cross-section and allowing more blood to be pumped through. The heart became stronger, making it easier to resolve a loss of territory. In the healing phase, the squamous epithelium is repaired with swelling. The coronary artery crisis is the infamous heart attack, in which, as we know, the coronaries are more or less occluded. We will discuss crises in more detail in a moment. In the healing phase of the squamous epithelium, microbes do not work. Earlier, Dr. Hummer also thought that viruses were responsible for the ectoderm. Colds, warts, jaundice, polio, etc. However, viruses almost certainly do not exist. The squamous epithelium, red group, therefore works completely without microbes. The lymph node has its biological purpose only at the end of the healing phase, through a permanent tissue reinforcement. The necroses stop with the conflict resolution, and the brain turns on the microbes, associated with the connective tissue. The bacteria. These necroses are now replenished with swelling. The lymph node begins to hurt and may become palpable from its size. Since it now has cell division, it is considered malignant in conventional medicine, lymph node cancer, Hodgkin's disease. We now have the microbes at work in the healing phase on the organ level. Now we visibly get deeper and deeper into vagatonia. The swellings due to the water retention, exudative phase, become larger and larger, and thus the pain becomes more and more. We get sick and run to the conventional doctor. He sees microbes at work in us and thinks that these microbes have caused this symptom. This is nonsense, of course. We do not declare the firefighter who extinguishes the fire to be the arsonist, just because of his presence at the fire. In the chapter The Fourth Biological Law of Nature, I explain the facts with the microbes more precisely. Note, each so-called infection is a healing phase. If you reacted with a pulmonary nodule in the active phase, this pulmonary nodule will be cauterized tuberculously, and you will have the symptom of pulmonary tuberculosis. With a conflict load of 5 minutes, this healing phase will cost you 1 cough. No more. If you experienced a death fright conflict related to your child, However, and if that conflict were active for months, then the healing phase would likewise take months, in order to break down the large lung nodule. For months you would cough, and your sputum would contain blood and tumor pieces. Conventional medicine would diagnose you with pulmonary tuberculosis, a terrible diagnosis if you are unsuspecting, and half as bad if you are in the know. If you reacted with a node of the mammary glands in the active phase, this node will also be tuberculated. The healing phase will take 5 minutes to clear the few cells with 5 minutes of conflict load. With a larger conflict load, this tuberculous healing may well cause a severe stinging in the breast. Has your shoulder been affected? With a larger conflict load, the lymph node swelling can be painfully noticed. If the bone was affected, you now have shoulder pain and cannot bring your arm up. The squamous epithelium is divided into the so-called pharyngeal mucosal pattern and the outer skin pattern. In the conflict active phase, the squamous epithelium ulcerates, no matter which group it belongs to, but the nerves behave in opposite ways. While the pharyngeal mucosal pattern is painful, angina pectoris, in the conflict active phase, plus the crisis, sensory-wise it is numb, and painless in the healing phase. The outer skin pattern is just the opposite. In the conflict active phase, plus the crisis, it is numb, and it hurts in the healing phase. With the loss of territory, angina pectoris immediately disappears, with the resolution of the conflict. However, the squamous epithelium of the milk ducts now begins to ache. Just as the coronary arteries are repaired under swelling, the milk ducts are also repaired under swelling and inflammation. With a very small conflict load of 5 minutes, you will not notice anything. With a larger conflict load, you will now have mastitis. With a large conflict load of several weeks, you will have the diagnosis of intraductal mama ca. With a loss of function, from the time the conflict is resolved, the function returns. So the beta islet cells slowly start producing insulin again, and the blood sugar goes down. I am sick. Now, in the healing phase, you are listless, have pain, fever, inflammation, night sweats, etc., depending on the respective SBS. You feel sick and run to the therapist. The conventional doctor gives you sympathicotonic drugs, that is, cortisone, antibiotics, or chemo. If you get well anyway, the allopath claims the healing success for himself. On the other hand, if you go to a homeopath, you get a globule. Days later, you have fallen even deeper into vagatonia, and the symptoms have become even more severe. Then the homeopath says, "Very good. That is the first worsening. We got the right globule." If you go to the Bruno Groening group, you will be told that you have to adjust to the healing current. So you adjust to this healing current, get deeper into vagatonia, and have even more symptoms. They explain to you that this is the so-called regulation pain, and everything would be all right. I think Voltaire said, "The art is to stall the patient, until nature has healed him." If you now know about these biological connections, then you don't panic so easily. You know why, and what to do, and how long it will take. Neither a therapist nor a remedy stands between you and your health. In the rarest cases, we would need emergency medicine. Germanische Heilkunde makes it free. The crisis. From the conflict resolution, the body gets more and more into deep vagatonia. The swellings due to the edema storage become larger and larger, which also causes the pain to become more and more. Many healing phases pass with fever and listlessness. In order to stop this falling into vagatonia, and steer the rudder back in the direction of health, Mother Nature has built in the crises in all SBSs, approximately in the middle of the healing phase. All crises, also heart attacks, are brain crises or are brain symptoms. There are brainstem, cerebellum, cerebral medulla and cerebral cortex crises. The crisis ends the exudative phase, in which edema has been stored in the brain and at the organ level. The crisis now has the task of squeezing out this edema water again. The vessels are changed to narrow, squeezing out the edema in the brain and organ. With the crisis also begins the urinary flood phase, during which you have to pee frequently. This is a striking symptom, if you know how to pay attention to it. Depending on the load of the conflict, the crisis can be a second spate and go unnoticed. But it can also last for several hours, even 2 to 3 days. It can have pre-crises, the main crisis, and post-crises, similar to labor pains during childbirth. These symptoms apply equally to all crises. The most imposing crises are those of the cerebral cortex. In the sensory brain crises, in addition to this centralization, extreme sympathicatonia, we have the absence. In motor crises of the cerebral cortex, we also have an epileptic seizure. The migraine is the crisis from the frontal fear relays, pharyngeal ducts derivatives, dental enamel. In the sugar relays, we have hyperglycemia or hypoglycemia in the crisis. Everyone experiences the crisis itself. The critical point is after the crisis. Here we check whether the crisis was strong enough to steer the rudder back toward health. If it was too weak, or if the load of conflict was too great, the person will no longer be able to make the turn toward health after the crisis, and will fall into the deepest vagatonia, into death. For this reason, one must not weaken a crisis by medication, that is, by vagatonic tranquilizers. On the contrary, one must strengthen it by sympathicotonic means, such as coffee, if one absolutely wants to intervene symptomatically. A trick of Mother Nature initiates the crisis, Dr. Hummer said. The individual's conflict, which has already been resolved, is once again brought before the individual's eyes. This takes place in the deepest vagatonia, which one usually has in such a healing phase around 4 a.m. Over the entire course of the Hummer's compass, one must imagine the normal day-night rhythm laid. Therefore, the vagatonic healing phase symptoms become worse in the evening, for example, with neurodermatitis or toothache. The crisis always occurs in the deepest vagatonia. It is also the worst phase so far. Usually, the crisis begins with the help of a dream, or the affected person has to think intensively about this former conflict. This is how one gets in distress, and thus initiates the crisis. Note, the crises are initiated by the psyche. So, about halfway through the healing phase, they dream that their child has had another accident. Still another small supplement at this time of 4 a.m. The birth of the child corresponds to the course of the crisis at the Hummer's compass. Most children are born around this time. In the deepest vagatonia of pregnancy, the sympathicotonic birth begins. Similarly, the time of death of old people, when do people die of natural causes? At 4 a.m. They die from the crises of their conflicts of many years, which became all the same to them with age. Brainstem crisis. If you previously experienced a fear of death conflict, related to your child, you now have a brainstem crisis. You are centralized with constriction of the vessels, cold extremities, and cold sweat. There is no conventional medical diagnosis for this. The fact that this crisis is registered at all by the patient himself, depends on the conflict load. With a conflict load of 5 minutes, one does not notice anything with any crisis. A brainstem crisis is therefore not particularly noticeable. Cerebellar crisis. If you experienced a care conflict, then a cerebellar crisis now takes place. In addition to centralization, we have the so-called cerebellar pain here, like the stinging in the breast in Mamaciae, or the inner skins. Cerebral medulla crisis. If you experienced a self-devaluation conflict toward your child, you are now suffering a cerebral medullary crisis. Don't worry, these crises are also unremarkable, except for centralization. Many beginners believe that a crisis would always be a heart attack, and would inevitably come after every conflict resolution, regardless of the special program. This is not so. Cerebral cortex crisis. In squamous epithelium, coronary arteries, milk ducts, in addition to centralization, you have absence. A patient in absence does not respond when you speak to him. It is as if he is absent. 1-second absences are not noticed. However, an absence can last for several days, while the affected person goes about his or her activities in a slowed-down manner. Absence can also lead to unconsciousness. In the coronary arteries, in addition to everything listed so far, you have severe angina pectoris, gullet mucosal pattern, and arrhythmias due to the brain relay, which is the cardiac center here. The bradycardic cardiac center on the right in the territorial area controls the coronary arteries. The tachycardic heart center on the left in the territorial area controls the coronary veins. During the crisis, in the coronary arteries, less and less impulses come from the brain relay to the heart muscle. In case of a conflict load of more than 9 months, no impulse at all comes from the brain to the organ, and that is heart failure. The fact that the heart attack patient has an occluded coronary artery is merely a secondary symptom and not causally responsible. So, this bypass surgery is not a causative therapy. In the case of the coronary veins, one has palpitations and pulmonary embolism in the crisis. Pulmonary embolism is also not caused by dissolved blood clots from deep leg veins, but by dissolved clots from the coronary veins. During the crisis, as in the conflict active phase, there is again cell atrophy on the squamous epithelium, resulting in previous healing crusts being loosened and washed into the lungs with the blood, where they become clogged in the pulmonary circulation. Again, the rule is that the crisis is fatal if a load of conflict exceeds 9 months. Clinically, we can predict this crisis, assess it, and if necessary, bring the person to the emergency room before this crisis. Clinically, we can tell if this conflict may be resolved at all. The patient has nothing to gain if the unsuspecting therapist helps him resolve an ancient conflict, and he dies in the crisis. I have to write this warning in the direction of those who only screw around on the psyche and do not understand anything about the organ level. So we can specifically prevent an impending heart attack by the affected person, staying actively on the track and not solving his conflict. But for you to even notice these crises in the coronary arteries, heart attack, pulmonary embolism, there must be a conflict load of at least 3 months. In the case of crises with less conflict load, you do not even run to the doctor. In a resistance conflict, you have severe hyperglycemia or hypoglycemia during the crisis, depending on whether the alpha or beta islet cell relay is involved. After the crisis, the beta islet cells produce lots of insulin, and you can get into dangerous hypoglycemia. That is why people with diabetes always carry glucose with them. It is just the opposite with the alpha islet cells with hypoglycemia. In the healing phase, the blood sugar rises, and in a crisis there is hypoglycemia again. Then the blood sugar normalizes, and the symptoms are gone. The critical point. From the highest point of the crisis, the individual falls back into deep vagatonia. All experience the crisis itself. One does not die in sympathicatonia. The critical point is shortly after the crisis. This is where we find out whether the crisis was strong enough to turn the tide towards health. If the crisis was too weak, or a load of conflict too great, one falls into the deepest vagatonia and death. The most blatant and seemingly most severe example from this multitude of different crises is the heart attack. If one has not resolved this loss of territory conflict again in a reasonable time of 9 months, one must not resolve it again. One would inevitably die after the crisis. The reason for this will be a biological one. In nature, not everyone is allowed to be the leader of the pack. In this, Mother Nature is strict. So the crisis has 2 tasks. First, to steer the rudder back towards health. Second, to check whether the person must not be taken out of the race. PCL Phase B. After the crisis, one enters the scarring, restitutive healing Phase B. If you manage to reach this critical point after the crisis, you take giant steps towards health from now on. The former doctors then said, now the patient is over the hill. The brain and organ level edema was successfully squeezed out and eliminated in a urinary flood phase. The swelling went down, and so did the pain. One still lies in bed and is listless, but the food tastes like never before. The lost weight in the conflict active phase is now replenished in a short time. Look at the date of this cartoon, 1888. Worrying symptom. Doctor. Well, how is your husband? Farmer's wife. Oh, quite badly, doctor. He is already so weak that he no longer had the strength to push away a plate with 6 liver dumplings, which my boy without my knowledge put beside his bed at noon today. He ate all 6 liver dumplings. So it is a very good symptom when the patient starts to like it again. In summary, after conflict resolution, you feel worse and worse, because you visibly fall into deep vagatonia. Then comes the crisis, where you feeling like you are going to die. From the crisis onward, things will continue to improve. Think about the last time you threw up. Before vomiting, you got worse and worse. Vomiting is the crisis of the small curvature of the stomach, motor and sensory, along with an absence. You thought now you had to die. After vomiting, you got better and better again. Eutonia. At the end of the healing phase, which lasts about the same time as the active phase, the normal day-night rhythm is restored, with absolute health. The child is healthy and has recovered from the shock. The brain relay is freshly scarred and remains so for a lifetime, without causing symptoms. The microbes have cleared the old brain tumors at the organ level, and the tissue is also scarred. The holes of the cerebellum-controlled special programs have been filled up again. The function has returned. One is like new again. Therapy recommendation. We should take care that something like this cannot happen again. Inferring from one level to the other. We are still at the synchronicity of the three levels: psyche, brain, organ. The individual must be thought of as a unity of these three levels. No cancer could bypass the brain or the psyche. If one separates the psyche from the organ level, the individual is dead. Because of this unity of the three levels, one can at any time and always conclude from one to the other two levels. From the brain to the organ level. The Center for New Medicine in Burgau, Styria, was a base, established in Austria by Dr. Hummer. Dr. Hummer's publishing house was located there, and he held his seminars there. Doctors worked there and issued sick notes to the patient, and the referrals for the brain CT. If Dr. Hummer came to a seminar, the patient participated together with his therapist. It must have been something special back then. With the case of my daughter Olivia, this center had to be closed. Dr. Willibald Stangl, chairman of the Scientific Association of Medical Officers of Austria, was reported by a patient who said that he would not work according to the state of science if he did not take the new medicine into account. The complaint was dropped, but Dr. Stangl now took a closer look at the new medicine and was enthusiastic. In a review conference, he confirmed the correctness of the new medicine with the seal of the authority. All hell broke loose over the honest medical officer. He was forced to withdraw his confirmation. Quote newspaper article. The public health officer was attacked every 2 minutes. Poor Dr. Stangl, he is now obviously caught between the millstones. And the conventional medicine rebel Hummer seeks to confront the opponents. Quote Hummer, above all, because I must now protect Dr. Stangl. So he wrote to the federal president, and described to him the facts as they appear to Dr. Hummer. In it, the cancer doctor asks for help for the public health officer from Tulln, who is being harangued every 2 minutes on the telephone, by the otherwise respectable medical professors and primaries, in the most foul-mouthed manner. The purpose of this action was to soften up Dr. Stangl and his family. The indomitable German continued. Then, at the beginning of April, he, Stangl, was summoned before a conference of the chairmen of the medical councils of all the countries of Austria. After this conference, Stangl had said to Hummer, "They fell upon me like wolves and mauled me." Dr. Hummer continues in the letter to our federal president. Dr. Stangl was forced, although still rock solidly convinced of the correctness of his results and of the new medicine, to sign a lapel, in which he withdraws his demand for a public scientific review, according to scientific rules. The photo in the article shows our then federal president Klestel, captioned with, "Dr. Thomas Klestel will have the case of Hummer and the new medicine examined." Oh, the hypocrisy! Of course, our federal president did not advocate a review. Before these dramatic events around this official doctor, a patient came to Burgau with his brain CT. Except for a pulling sensation in his testicle, he had no complaints. From his brain CT, Dr. Hummer, together with Dr. Stangl, diagnosed testicular necrosis. They sent the patient to the radiologist, who confirmed this testicular necrosis on the organ level. If you know one level, you know the other levels. From the brain to the psyche. This case study is about a live case at a Hummer seminar in Spain. When the master personally celebrated a patient case, one learned the most as a student. It was about a prostate patient, in whom the PSA value was decaying. The PSA value is a tumor marker. No tumor marker can show cancer cells floating around in the blood. These supposed tickling crawling cells have never been seen. If this PSA value is elevated, then the special program of the prostate is running. The cause of prostate cancer is an ugly semigenital conflict. Semigenital means that sexuality is involved, but not the core of the problem. A typical prostate conflict is, when the older man, who no longer has territorial behavior because of the change in age, has the younger woman run away in favor of a younger man. This is exactly what had happened to the patient. The patient confessed to Dr. Hummer, but did not want to admit in public and in front of an audience, that this was a young man who had left him. The patient himself was 70 years old and had been married for 30 years. However, he had recurrent homosexual relations during his marriage. Dr. Hummer took the CT of the patient under the magnifying glass, in front of the audience. And he confirmed the edema in the brain relay for the prostate and the brain stem. So he was already in the healing phase, with his prostate CA. But then Dr. Hummer faltered, because he saw an active, sharp ring of a Hummer focus in the edema. Apparently, the patient suffered a recurrence in his healing phase. He must have gotten on the track. Possibly he met this young man again, or talked to him on the phone. Something must have happened. Note: in the case of a relapse, the SBS starts again on all 3 levels. Astonished, Dr. Hummer asked the patient, "Tell me, was there something again?" Since the patient did not want to admit that this was a young man, he tried to distract in front of the audience, looked out of the window, and declared, "Oh, do we have nice weather today?" So, Dr. Hummer realized from the brain CT that the patient must have met his young lover again. From organ level to psych. For the beginner, going from organ level to psych is the way to start. Relatively quickly he learns that the bowel is an anger conflict. The outer skin is a separation conflict. The bone is a self-devaluation conflict, and so on. The organ level cannot lie either. If a symptom is present, then a corresponding conflict must have happened, period. At a lecture, an elderly lady asked me if it was true that osteoporosis was cancer. Her family doctor would have denied that. Now I explained to her for the time being that Dr. Hummer says cancer to all special programs that have either cell plus or cell minus in the active phase. To the functional failures which have no cell changes, he says cancer-like disease, or cancer-equivalent disease. Because they also follow the pattern of Hummer's compass. She said that osteoporosis with its cell loss is the active phase of a self-devaluation conflict. I asked her further where she had osteoporosis, because each bone and joint had its own self-value content. She said she had osteoporosis in the pubic bone. The pubic bone has as conflict content a sexual self-devaluation conflict. In the sense that one cannot offer the partner sexually, for example if the partner had a younger woman as a girlfriend. Then this old lady replied, "Exactly, that is the case. My husband has a younger girlfriend." Precise as Swiss clockwork. I am always amazed how exactly Dr. Hummer has discovered all this, and how Mother Nature does it all. As long as this old lady lies alone in her bed, and broods about what her husband is doing with this younger girlfriend, she will have osteoporosis. She can swallow kilograms of calcium, but it will not be able to help her. As long as she has this active conflict, as long as the command of cell degradation to the bone tissue comes from the cerebral medulla. This is the program of Mother Nature, and it runs equally in all individuals. There are no alternatives to the laws of nature. You have to understand them and learn to deal with them. If this old lady realizes that her husband not only has a younger girlfriend, but is also the reason for her osteoporosis, the patient can think in a solution-oriented way. Wait. My husband, that ass. In 14 days, at the next dance, I'll get myself a better man. It is no longer a conflict, if she can then laugh about it. And the bone recalcifies. Whether you add extra calcium or not is irrelevant. If the body needs it, it gets it from vegetables or elsewhere. This is the difference between a symptom-oriented approach of conventional medicine, and a cause-oriented approach of Germanische Heilkunde. But beware. This new partner is not available on prescription. You have to organize it yourself. We are accused of not having therapy, because we don't give the patient pills and don't work on him manually. It is much simpler to swallow a pill than to put one's own life in order. But this is not recognized as a therapy. To this day, we parents are accused of having done nothing at all with our daughter Olivia at that time, and of having refused any kind of therapy. We wanted to build a house, at that time. And my wife had become a full-time employee. That was precisely the conflict for Olivia. Her mother was suddenly gone, and the child reacted with starvation conflict. If the mother was there, the child ate. If the mother was gone, the child refused to eat. She also had pavor nocturnes, a nighttime panic like crying out, a brainstem constellation. It was as if the child had seen a ghost, in the middle of the night. It took my wife hours to get the child back to sleep. On Dr. Hummer's advice, the mother to quit her job as a teacher, and stayed with her children from then on. For Olivia, that was the conflict resolution. She came into healing with her liver cancer, and developed a huge liver swelling because of the syndrome. The therapy for Olivia's liver cancer was to take away the child's distress, to give the child back its mother. But the official conventional medicine does not want to accept this as a therapy. Chemo, radiation, radical surgery, yes, that is considered a therapy. Because they make a fortune out of it. The suffering of the patients is not only indifferent to them, they feast on it. From psyche to the organ, Hummer. The most challenging thing is to conclude from the psyche to the organ level. But this is also possible. 25 oncologists invited Dr. Hummer to a review, but secretly wanted to trick him. The chief oncologist said to Dr. Hummer, "You have your 3 levels, which always run synchronously. You are the discoverer and so seen as the master. We can expect masterful things from a master. You have a patient before you, of whom we know his findings. We told the patient nothing at all. You may talk to this patient. But you will not get a brain CT, nor will you get to see an organ CT of him. If you find out what this patient is sick with through the conversation, we will confirm your discovery." Dr. Hummer talked to the patient, and diagnosed a bronchial CA and another cancer, but I forgot about it. The head oncologist freaked out and raged, "No, that can't be. Then conventional medicine would be wrong. We confirm that you were correct in the case, but that this is charlatanry." In fact, these gentlemen wrote charlatanism under the certificate. Look up, dear reader, the term charlatan. A charlatan pretends to be able to heal, but cannot. Who is the charlatan here? Similarly also the church appears, "Only through me will you go to heaven." Dr. Hummer prophesied that at some point, one would speak about today's conventional medicine as they would the Middle Ages. From psyche to organ, Pilhar. I was once fortunate enough to have such a difficult diagnosis by chance. I had fallen out with my best friend over Dr. Hummer, and we didn't speak a word to each other for years. But then my house building project brought us together again. One day we were sitting at the kitchen table and told each other what had happened in the past years. He told of a scream therapy he had done, where he was supposed to scream everything out of his body. In a soundproof room. In the process, images from his childhood kept coming back to him. He saw himself as a 5-year-old, standing in the room next to his father's deathbed. His father had died. If such an image is indelibly present in the memory, then a conflict has happened. The brain snaps like a camera during DHS. If the boy's father dies, a lost conflict with testicular necrosis is apparent. In the healing phase, the testicle swells. I asked my friend if he had testicular pain at that time. With big eyes, he answered my question in the affirmative. From his wide eyes, I realized that I was correct and claimed that first he must have a larger testicle. And second, it was his right testicle. My friend is right-handed, and the father is located on the partner side. Right on target. My friend tells me about an event from his childhood. I recognized it as conflictual. I have a scientific diagnosis chart in my head, by heart. You can put yourself roughly in the shoes of a 5-year-old, who has just lost his beloved father. A lost conflict with testicles is apparent there. And I could tell my friend what his organ level must be. I find this fascinating. In the past, before the Olivia case, I was a software engineer for freely programmable controllers in the industry. As a technician, I am excited to be able to study this biological code in the living. This software engineer is Mother Nature. In that sense, I don't need any other religion. Especially in such conversations as with my friend, every willing person can help to spread the Germanische Heilkunde. The better he himself has understood the Germanische Heilkunde, the sooner he can bring the matter to the point with his counterpart, so that he is amazed. There is a good chance that fire of enthusiasm will be kindled in the other person. Then you have incurably infected him with Germanische Heilkunde. From psyche to organ, nurse. A nurse participated in a seminar and spoke about his experience with Germanische Heilkunde. A patient told him about a tragic accident several decades ago, in which he was directly involved. A little boy fell off the tractor, and the carnival parade trailer rolled over the child's rib cage with its twin tires. And his insides spilled out of his mouth. He knew the child and also his grandfather who was responsible for the accident. They were friendly families. The nurse told the patient that he must have vitiligo. The patient asked startled, who had told him about this? No one. In fact, the patient has had vitiligo across his chest since then. Precisely in the place where the wheels rolled over the child's body. The nurse heard from the patient's accident account that he had found it an ugly separation. Whether the nurse could also guess the location of the vitiligo, I do not remember today. It is possible. From organ to brain. Of course, it is also known from the organ level, where in the brain and in which relay the hummer's focus must be located. However, this circumstance does not make the brain CT superfluous. If, for example, a prostate patient has problems with peeing, then there are two possibilities for this. Either the conflict is active and cell division is present, or the conflict is resolved, and the prostate Ca is tuberculously degraded, under the swelling. In both cases, the prostate Ca is occupying space, and pressing on the ureter. With a handshake, one could now recognize whether the patient is conflict active, cold hands, or in a healing phase, warm hands. However, there is also a mixed innervation. For example, with one SBS the patient is active, and with another in the healing phase. Then he has neither clearly cold, nor clearly warm hands. On the other hand, in the brain CT it is quite easy to see whether the hummer focus in the brain relay for the prostate is active, detached, or in a suspended healing. As already mentioned, the therapist of Germanischen Heilkunde will always consult all three levels, in order to arrive at a precise diagnosis. The brain CT is the diagnostic procedure of Germanische Heilkunde. One can learn to read it. It is not supposed to be very difficult. However, being able to read the brain CT does not make one a good therapist. The therapist also needs empathy. Above all, he must be allowed to practice legally. With this concluding example, I would like to end my remarks about the synchronicity of the three levels of psyche, brain, organ, and hope to have emphasized the importance of the inseparability of these three levels. Viva la Medicina Sagrada! Helmut Pilhar, father of Olivia,